Hi, I'm New York State Assemblyman Joseph Saladino. I represent you and this community up in Albany in the state capitol in the New York State Assembly. Part of my job is to craft legislation that assists our communities, but another important part of our job is working on the New York State budget. Each year we put together a budget that has spent more and more, and I have been one of those fighting for cuts in the New York State budget to get spending under control. This year we formulated a budget, we got it in on time for the April 1st deadline, and our New York State budget cut over $2 billion in spending from 1 year prior. So that's a step in the right direction. We're also able to work with Governor Cuomo to make sure that our Long Island school districts received more in state aid than they did just 1 year ago. So the issue of bringing back more state aid than the governor had proposed is very, very important, because state aid is an essential part of the revenues for school districts. One of the chief issues that I've been working on is looking for ways to protect Long Islanders. A few years ago, Albany and the leaders at the time decided to create an MTA payroll tax that every business owner, every municipality, every school district, the county, the towns, the villages, all had to pay. It provided us no additional services, and most of the businesses that were taxed do not rely on public transportation, nor do their employees, and yet they have to pay this tax. School districts pay quite a bit in an MTA tax, that unfortunately they must pass that along to property taxpayers. So I've written a bill to repeal the MTA tax from Nassau County. Any business in Nassau County, any government in Nassau County, it's time to get taxes under control, and an MTA tax is just moving in the wrong direction. So we're trying to get that bill passed to repeal that tax. An unfunded mandate is what happens when the state forces another municipality to perform a service. In the case of Nassau County, for instance, Nassau County has to provide health care for people who cannot afford it, Medicaid. Each year, the parameters surrounding Medicaid create a situation where more and more people are taking advantage of Medicaid, but there's very little way to pay for it. The state forces this unfunded mandate on the county has to raise property taxes in order to pay for it. That's not fair. Our county executive, Ed Mangano, has been doing a superb job, especially because when he came to office, there were looming deficits, and he has managed to balance a budget. We believe by getting rid of the MTA tax that the county has to pay, by greatly reducing the unfunded mandates, it brings more ease for a municipality to operate, school districts as well. We are trying to bring some reform to the Medicaid system. Right now, the largest component in the state budget is Medicaid, to the tune of about 47% of the budget. Tremendous amount of money, billions and billions of dollars, almost $50 billion are spent in Medicaid each year. So we need to change the parameters. We estimate between $5 and $10 billion a year is spent in waste and fraud of the Medicaid system. Well, what do we mean by that? There are doctors who bill for patients that don't exist, or for more hours than there are in the day, or unnecessary treatments and tests after test after test. That's one of many ways that there are fraud. But the parameters that New York State has decided over the years to use to decide who gets Medicaid, who qualifies, are pretty amazing. What people don't realize, and I used this quote in my debate on the budget right on the New York State Assembly floor during our budget debate, is the fact that today people are going to doctors in foreign countries, Russia, the Ukraine, many, many countries. Doctors in these countries examine their patient, determine that they need a very expensive surgery, perhaps a cardiac surgery, a very expensive surgery, and tell their patient, don't sell your home, just buy a one-way ticket to JFK Airport in New York, complain of chest pains on the plane, and don't tell anyone we've had this conversation. Well, that's horrendous. That someone, we want to help people have a heart, we all care, we want to help people in need. But the idea that someone from a foreign country who has never been in our country before, has never paid taxes here, has never worked here, can fly in, get unlimited amounts of health care, whether it be surgeries, aftercare. We even send a nurse to their home or their hotel to treat them after their surgery. And we're all paying for that. Now, we want to provide health care, but it's difficult enough to provide health care for New Yorkers, poor New Yorkers, for undocumented aliens who also get free health care as well as free schooling. They get many of the services that legal New Yorkers receive. It's difficult enough to pay for that, but the idea that we're going to also provide in the hundreds of millions of dollars of Medicaid for foreign people visiting New York from foreign countries, means that now we are not only the healthcare provider for poor New Yorkers, but the healthcare provider for the world. I don't think that was the intention when Medicaid was created. So we are obviously going to care for the sick and the indigent and the needy, but there must be more limits. And the last thing that I wanted to talk about was Albany reform. There are quite a few reforms that I've been pushing for during my years in office. We'd like to see a lot of the politics removed from the process in Albany. Committees that have a equal ratio of Republicans to Democrats. Funding for our offices equal. We'd like to see legislation reach the floor. We'd like to cut out a lot of the wasteful spending that Albany does, which is one of the bills that I have, which calls for a cap on state spending. If we're going to tell the public that they have to get their books under control, we in Albany must do that too. So a state spending cap would force the state to control their spending so we don't keep pushing deficits on the public. That's wrong. That I've been fighting against. So we're looking to continue having on-time budgets. We want to get more aid for our school districts and our local municipalities, our village, our county, our towns. We want to continue to cut spending overall, but make sure that our schools are properly funded. That's unfunded mandate relief that we spoke of, very important issue. And reform of Medicaid, as well as Albany ethical reforms. We need great reforms in the way Albany operates. These have been a large part of my agenda, as well as protecting women and children from predators and protecting our environment, and continually looking for ways to protect taxpayers. That's what's going on in our state of the state, and I'm Assemblyman Joseph Saladino.